welcome to this video. Hi, I am Nishigandha and I am a psychologist working at OLive Counseling, and this is...
Hi, I'm Kelly and I'm a psychotherapist at OLive Counseling.
Okay, so here is the topic we are going to discuss. If younger therapists have a negative effect on therapeutic process.
Right. So this topic that we're going to discuss, we're going to do it in three parts. The first part is going to be where we portray or put forth what other psychologists have said about whether age matters, whether younger therapists are better than older therapists, or whether older therapists are better than younger therapists, and that is what we're going to put forth in the first segment. In the second segment, we're going to talk about our opinions, what we feel is the case, what we feel this topic basically entails and things like that. And the third segment is going to be where we put forth some tips for the therapists, for the young therapists out there who are facing the problem of age resistance from their clients. So Nishi will start us off.
Okay, so as I have been reading many articles on this topic, I have found out that many clients prefer having experienced therapists, and that's because probably they have a feeling that they are more old, and they, as the time progresses, they have a deeper knowledge about the thing. And also it is seen that older therapists have been through many life events like deaths. They have seen deaths, or they have marriage, they've been in a marriage, or they have things, life events like these. So because of that, they have a better knowledge as compared to the others. So that actually is like a first-hand knowledge is seen that way, and that's how they can get confidence and they can talk to them properly and have a good rapport building. That's a thing that is seen. And also it's seen that as they have a lot of experience, they are in less shock. They are used to it. They are okay with accepting the facts from the clients.
So you're saying they make the clients feel comfortable. Okay.
So these are the things that I've seen in articles.
So basically, you've mostly read articles that state that older therapists are more better in giving forth or therapeutic processes than younger therapists.
Yes.
All right. So contrary to her, I have found articles wherein it didn't really matter, and also it said that younger therapists also do give better or similar therapeutic processes the way older therapists do, and age doesn't really play a factor in this, or it says that one age group is better than the other and things like that. And just a thing to clear up, when we talk about younger therapists, we're talking about the ages of between 25 to 30, young adults, not someone younger than that who's probably still graduating or in university. So what I have read is that a lot of people have this conception, or they've conceptualized what a psychologist should be like, or what a psychologist should look like. You ask any random person. I have asked some people, and I've asked them, what do you think a psychologist would be, in your head, without thinking about us being psychologists. What do you think they would be? And they said an elderly woman with spectacles, maybe whitish hair, looks like she's gone through a lot. And I've read an article that said probably because Freud has been such a prominent part of psychology since before, everyone thinks that everyone who's a psychologist should look like Freud. Just like maybe scientists should look like Einstein. Yeah. It's similar to that. Secondly, clients also have a conventional thinking. some clients have a conventional thinking that may say that older people, the way you said it, some older psychologists have better knowledge, have better experience than the younger therapists. And maybe they do, maybe they don't. Because if you talk about, say, life experiences like death, I'm sure that many young therapists or young adults have gone through the grief, have lost somebody and have gone through that. Also, a good session, a good therapy session does not or is not based on experience. It is based on the mood. It is based on what the therapist and the client feel, whether they're comfortable with each other, whether the client can say things to the therapist, tell the therapist things. So sessions are meant to be more eloquative, about the mood and things like that. Secondly, we don't give advice the way clients think we do. That conventional thinking that you are a therapist, you are a counselor, so advise me, tell me what to do with my life. We don't give advice, we guide you, we help you go through it, right? Two psychologists, one from Harvard University, she's a professor there and a psychotherapist, she said that there is no evidence stating that experience is needed for sessions to be successful. And second is Sabrina Bowen. She is a psychologist. She also said that experiences or having the similar experiences as the client or having similar situations as the client could be a hindrance to the session, because probably you have the same ideas, you have a bias, you have your own opinions that really we can't put into. We cannot put our own opinions to the client. So yeah, those are what we have read and what we have portrayed and pointed out to you. So now that we have put forth the points that we have read, we are going to put forth our opinions. So let's start off with Nishi. What do you think? Do you think that younger therapists can do the similar jobs that older therapists do?
Actually, I feel that yes, they can do it. One, because they can probably understand, or it depends on their maturity level also.
Right.
So if they are quite mature enough, so I think they can also handle older patients.
Yes, of course.
Clients level.
And there will be some saying that younger therapists can't be mature, but one thing that we know is maturity doesn't really come from, or at least emotional maturity that you need in therapy doesn't really come from age
or experience. Yeah, so that could be one point. And also, if there are younger clients,
right,
they will be more comfortable in talking to younger
Yes.
therapists because they have their same perspectives and similar ideas and
Yes.
other things.
I mean, a lot of younger clients, when talking to maybe an older therapist, would be like, they won't understand my sex life, or they won't understand me complaining about my parents. They will take my parents' side, or they might say I'm too young to have sex and things like that. So what is the use of basically going to a therapist if they don't understand that? Also, what should, if everyone has this perspective that younger therapists aren't doing a good job or will not be able to do a good job, what are they supposed to do? How are they supposed to learn? How are they supposed to go ahead in that field? Because there are a lot of young professionals who are trying to do that, but they can't because of their perspective.
But that can be possible with training and internships and doing a lot of courses like workshops.
Right.
That can be attained, like you can have an experience through others and also through doing such courses and stuff like that. So that
It
is
can be,
possible.
I agree. But also I still stand by my course, because how long are you going to be an intern? How long are you going to wait till you can open your own clinic, till you can be, I am a psychotherapist, and no one says to you, like, so young, how can you be a psychotherapist? Or how can you tell people what to do with their lives when you haven't seen life? These are the kind of things that probably younger psychologists hear.
So I think you can have an experience with, attaining a license. And with that license, you can go ahead and have more experience and then try to explore by yourselves and attain knowledge.
And I think also another way young therapists can do it is by just going into the field, working for obviously another therapist who is much older, who has an established clinic, and working there as a therapist, taking on cases, because you can always discuss cases with them to a certain amount, but not have them supervise you. So you can have the freedom and you can get the experience you need to further be confident in taking on cases. Yeah? So is that it? Should we move on to the tips?
Sure.
Alright. So some tips for the younger therapists who are out there and who are facing the age resistance from your clients. The first thing is you need to dress professionally. You need to present yourself professionally. The way you talk, the way you dress, the way you are groomed, or the way you just need to present yourself in a way that you seem more mature
and confident.
And very confident. Yes. Secondly, you need to do a good work in your therapy. You know your matter. You know what you're supposed to do. Just be confident and be able to deliver it.
True.
Have a good session one by one and slowly. You don't need to rush it. You don't need to. You need to take it slowly. Show how good you are through time. And everyone will then know that, okay, maybe I misjudged this person. Third, resist being defensive when it comes to someone saying to you, are you young? Are you, how can you, you can probably only counsel my child, or my nephew.
You're not of that age that you can understand me better.
Yeah, especially when you tell parents something about, what they can do, parental techniques, and they go, you aren't a parent, so you won't understand. Things like that. So don't be rattled when you hear something like that. Just calmly listen to them, calmly tell them what can be done, and don't let them get into your head. Don't let them rattle you. Also, the fourth and most important is show your knowledge. We as therapists are always told that the client is not as educated as we are. Always assume that the client doesn't know much and tell them even the smallest things. So our session after a rapport is basically a psychoeducation session, and that is very important. So show them the knowledge that you have through psychoeducation. Tell them what kind of therapy you're using. Tell them how many sessions you're going to have, right? And don't do it in a way that shows you're too egoistical or you know too much and things like that. Be as natural as possible. Just do it like a teacher would do to their students.
Correct.
And the last one, which would be a little difficult, but I think you should do it, is to address the elephant in the room. That is your age. If you feel that you are receiving some kind of resistance from the client regarding your age, they're trying to question your abilities. They're trying to question your abilities, or they're trying to question your methods. If they are doing those things, ask them, is my age bothering you?
Yeah.
Why is it bothering you? Or how is it bothering you? Right? And then maybe you can work on it, or just get it out of the way. Get the fact that you are already 25 years old, or you are 24 years old, and you are a psychotherapist or a psychologist or a counselor to someone who is of the age of 40 or 38. Get that out of the way. And I think if you are able to do these kind of things, you should be able to get rid of that notion, of that prejudice that young therapists aren't able to really have sessions or really counsel someone, right? Any closing statements, Nishi?
Not really. I guess the age does matter,
Mm-hmm.
and also doesn't matter is
Right.
now that we have a discussion about.
I think it's just being comfortable.
Just being comfortable and experience also does count, is what I would like to conclude it as.
Yeah. So I think that's it. What we'd like to say is, clients, as long as you're comfortable with your therapist, it's all right. Go in there with an open mind. Go in there with no bias and no any kind of filter. Go in there as if your therapist, because your therapist is there to help you, regardless of their age or gender. So you should too. You should go in there because you need the help, and they are there to give it to you. All right.
Yeah.
So thank you for watching this video. I hope you liked it. Please comment. Any questions, suggestions, please comment below. Like, subscribe, share this video to everyone. If you all want, and if you want more information about our services, please visit our website www.alllifecounseling.com. Thank you.
Thank you.